Hi, I'm Dr. Dan Shapiro. I'm a board-certified plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing here in Scottsdale, Paradise Valley for over 21 years, and today I'm going to talk about what are the different kinds of implants that you can have put in if you're thinking about a breast augmentation. Back in the early 90s, silicone was taken off the market, and it's been shown that there's no cause and effect relationship between silicone and any disease, so they were brought back in the market close to 10 years ago. There are still some patients that can have a saline implant or a silicone implant. Most patients request a silicone implant these days because I think that they look and they feel better. The different kinds of implants that are placed, and generally I place the implants beneath the pectoralis muscle, vary from saline to silicone, and the silicone implants now versus earlier models are what we call low bleed or cohesive gel, and you've heard of the term the gummy bear implant. Almost all of them now are some variation of a gummy bear implant, which means if you cut it, the silicone will not leak. It's like a jelly. So that kind of concern with patients should really be no longer. But with regards to shape, it really depends upon what a patient's needs are. And the way to think about it is that you can have an implant that looks more like a pancake, which we really don't use anymore, one that we call moderate profile, which is probably the most common implant that I use, and that has a moderate shape here, and that looks as though the dome on the implant is not so pronounced. And then there is the high profile implant that if you see, these are both about the same size, and one implant has more of a dome and actually has more volume to it than the other implant. A high profile implant as opposed to a moderate profile implant would be used in someone who might have a bit of droopiness to their breast or has a narrow chest. A common person that would need a high profile implant is let's say an Asian patient who has a very slight body stature, and we want to put an implant that gives nice size but doesn't exceed that width so she doesn't look too busty. The other kind of implant that is becoming more prevalent now is the anatomic or teardrop implant. In the past we used those, but they weren't as good because the silicone that was used in them prior was more prone to ripple. Now the implants that we talked about are the cohesive gel of the gummy bear, and they tend not to ripple and stay in place and maintain their shape. Who is a good candidate for a gummy bear anatomic implant is someone who has really no breast tissue or has minimal ptosis or droopiness. A lot of patients that come in that have no breast tissue and look flat are great candidates for this because the end result looks much more natural with less superior fullness. But the best way to figure out what your options are is to come in for consultation, bring in pictures of breasts that you like, and we can talk our way through it, take some measurements, and give you an idea about what's best for you. Thanks a lot.